You open your mailbox on a Tuesday afternoon and find a thin white envelope with a window. You open it to find a bill for $400 for a 15-minute routine blood test that your doctor explicitly assured you was completely covered. Your stomach tightens. You feel a sudden surge of heat in your neck. You immediately tell yourself that you made a mistake. You assume you picked the wrong laboratory, or misread your policy, or forgot to ask the right question during your appointment. But you did not make a mistake. Your brain is reacting to a real financial threat, and your memory is completely accurate. The system was engineered to produce exactly this moment of confusion. The United States spends over $4 trillion on healthcare every single year. That is more than $12,000 for every man, woman, and child in the country. No other wealthy nation comes close to spending this amount. Yet millions of Americans spend hours every month arguing over claims, calculating out-of-pocket costs, and deciding whether they can afford to fill a prescription. Why does having health insurance in America often feel like having a second full-time job? To understand why this happens, you have to look at how health coverage actually works behind the scenes. When you purchase a policy, you are entering into a contract governed by complex rules designed to manage financial risk. The central mechanism of this system is the deductible. A deductible is the exact amount of money you must pay out of your own pocket every calendar year before your insurance company pays anything toward your medical care. According to long-term data from the Kaiser Family Foundation, average individual deductibles for employer-sponsored plans have more than doubled over the past 15 years. While your paycheck has likely grown by small increments, your financial burden before coverage begins has skyrocketed. Have you ever wondered why two people receiving the exact same medical care in the same hospital can receive completely different bills? It comes down to a network of hidden negotiations. Every insurance company negotiates private rates with hospitals and doctors. If a doctor is in your network, they have agreed to accept a discounted rate for their services. If they are out of network, there is no agreement, and you are left exposed to whatever price the medical provider decides to charge. This creates a hidden maze for your brain to navigate. Even if you carefully choose an in-network hospital, the specific radiologist who reads your x-ray or the anesthesiologist in your operating room might be an independent contractor who does not participate in your plan. You do everything right, yet you still receive a surprise balance bill in the mail. Let us walk through what actually happens inside your life when you try to use your coverage for a routine issue. You visit your doctor because you have been experiencing persistent joint pain and chronic fatigue for 3 months. Your doctor listens carefully, examines you, and decides you need a specific magnetic resonance imaging scan, an MRI, to check for soft tissue damage. Your doctor writes the order. You leave the clinic believing that the hardest part is over. But 2 days later, you receive a phone call from the clinic receptionist. They inform you that your insurance company has denied the scan request under a policy called prior authorization. Prior authorization is a procedure where your doctor must submit detailed paperwork to demonstrate that a test or medication is strictly necessary before your insurance company will agree to cover it. The term sounds like a standard quality check, but in practice it creates a massive administrative barrier between you and your care. A study published by the Harvard T.H. Chan School of Public Health found that administrative complexity accounts for nearly 30% of all healthcare spending in the United States. That is hundreds of billions of dollars spent not on doctors, nurses, or medical equipment, but on billing specialists, claims adjudicators, and call center software. So what happens to you while this paperwork moves back and forth? You sit at your desk with 3 separate internet tabs open on your screen. On the left is your patient portal, showing the doctor's original order. In the middle is your insurance company's portal, showing a status marker that reads pending review. On the right is your bank account balance. You find yourself spending your lunch break calling customer service. You navigate an automated phone menu that asks you to repeat your member ID number 3 times. You are placed on hold for 42 minutes while listening to distorted background music. When an agent finally answers, they inform you that your request was rejected because you have not yet completed 6 weeks of physical therapy first, a rule listed deep inside a 90-page policy document you were never sent. How does this constant uncertainty affect your physical body? When you live with unresolved health symptoms combined with financial anxiety, your body remains in a state of persistent low-grade stress. Your adrenal glands release cortisol, the hormone responsible for mobilizing energy during danger. In short bursts, cortisol protects you. But when financial uncertainty keeps your cortisol elevated for weeks, it disrupts your sleep, elevates your blood pressure, and promotes systemic inflammation. You are not just stressed about the bill. The stress of navigating the insurance system is actively degrading the very health you are trying to protect. Consider another core part of the machine, the prescription formulary. A formulary is the master list of medications that your insurance plan agrees to subsidize. These lists are not static. They are updated frequently by pharmaceutical middlemen known as pharmacy benefit managers. If a drug manufacturer changes its pricing agreement with your insurer, a medication you have taken safely for 5 years can suddenly move to a higher payment tier or disappear from your covered list entirely. Overnight, your monthly copay for a critical daily medication can jump from $20 to $300. When faced with these sudden costs, many people make dangerous compromises. Researchers at the Commonwealth Fund surveyed thousands of working-age adults and found that over 40% of Americans have delayed or skipped necessary medical care, diagnostic testing, or prescription refills specifically because of cost. You might find yourself splitting your pill doses in half to make them last longer, or skipping a follow-up appointment because you cannot risk another unknown charge on your credit card. You blame yourself for not saving enough money or for not understanding your policy better. Why does the system operate with so much friction? The counterintuitive truth is that administrative friction is a core operational strategy in modern healthcare economics. Every extra form required, every claim, denial that must be appealed, and every long phone wait creates a barrier. A significant percentage of patients in overwhelmed doctors' offices simply give up when faced with the initial denial. When a claim is abandoned, the insurance company avoids paying that bill. What feels like a frustrating administrative mistake to you is, on a corporate ledger, an effective mechanism for controlling expenditure. Under the Affordable Care Act, insurance companies are required to abide by something called the medical loss ratio. This rule states that insurers must spend at least 80 to 85% of the premium dollars they collect directly on medical care and quality improvement. Only 15 to 20% can go toward administrative costs and profits. While this was designed to cap corporate profits, it created an unexpected incentive structure. If an insurance company is capped at taking a 20% slice of a pie, the only way to make that slice financially larger over time is to make the entire pie bigger. Rising overall healthcare costs allow insurers to collect higher total premiums while maintaining their fixed percentage margin. This is why health insurance in America feels so deeply disconnected from actual human well-being. The system was not constructed by evil individuals sitting in a dark room. It evolved through decades of competing financial incentives, policy compromises, and corporate consolidation. Doctors are exhausted by spending hours every night doing paperwork instead of seeing patients. Patients are exhausted by trying to decode medical bills that arrive months after care was delivered. So what can you actually do when navigating this environment today? First, recognize that a claim, denial, or a surprise bill is rarely the final word. It is often just the opening position in a complex administrative process. Studies show that when patients formally appeal denied insurance claims with supporting documentation from their doctors, a significant percentage of those denials are eventually overturned. Knowing that the system relies on friction means you can use persistence to your advantage. Keep detailed notes of every phone call, write down the names and reference numbers of customer service representatives, and always request an itemized bill from the hospital before paying. Second, reframe how you think about your own health choices. When you feel anxious, confused, or overwhelmed by a medical bill or a coverage denial, remember that your frustration is a rational response to an irrational design. You do not lack discipline, and you are not bad at managing your adult responsibilities. You are simply trying to maintain human biology inside a system optimized for financial management. The next time you open your mailbox on a Tuesday afternoon and pull out that thin white envelope, remember this single truth. That piece of paper is not a reflection of your personal worth, your intelligence, or your ability to take care of your body. It is simply the output of a multi-trillion-dollar system. and understanding how that system works is the first step toward taking your power back.